At the Kentucky Foothills Therapeutic Horsemanship Center, Mark and Cheryl are using horses to help veterans and children with disabilities. They're located at Jacks Creek in Richmond. They have many horses to help people, such as Zephyr, Roy, Woody, and Jack, and that's just to name a few. Well, how do they keep their horses healthy to keep their people healthy? First, they start with grooming. Usually, it's done before every ride to help the horses and the riders get started. They also perform weekly hoof care to trim and maintain the horse's feet for the riders. Twice a year, all the horses receive a wormer like the video shows. Next, Bill will explain about the dental care necessary to maintain a healthy horse.
This is xylazine, and it's a tranquilizer that we use to sedate these horses so we can get up to our elbow in their mouth. There's 2 cc's of blood. Now, I normally don't have to do this, but what I did was I drew this blood so that you could see what it's like to do a blood draw. And if you need to do a Coggins test on a horse, you draw the blood, put it in a tube, squirt it out in the tube, send it off to the lab. They do the Coggins test, and then you get your paperwork back on the horse. Coggins test is basically, it's just a test to make sure that your horse is disease-free. This medieval looking thing is a speculum. The reason we use a speculum is because you can't ask a horse to say, ah, and have it happen. Now we have an open mouth. Having an open mouth gives us an opportunity to do, and you normally start looking at the incisors. There's 12 of those in an adult horse. There's 6 in the top, 6 in the bottom. Of course, you can't see these because of the tongue. There's, in an adult horse, you're usually going to find 24 molars, 6 in each of 4 different arcades. And each one of those teeth have to be checked to see if there are sharp points, which is the lower jaw, is narrower than the maxilla. So what happens is you get sharp points on the lower outer edge up here on the maxilla, teeth in the maxilla. On the lower teeth, on the inside, upper edge, you get these sharp points. So the upper teeth, when they get sharp, will lacerate the cheek. The lower teeth will... See her ears? She's not dead, she's moving. Now here's what's going on. When you start this thing up, you get very little movement. It just moves that much, but it's really fast. And it will bite you. If you get your finger in the way... Okay, once you get done, you get back in here and you put your finger on every tooth. You want to make sure every tooth is not... You can work a horse's mouth from side to side, let the molars rub against each other, and you can tell whether they're hanging up or not. If they're hanging up, then you gotta go back and do it again. But this, this is just nice, smooth motion. You go from there to the incisors. You look, make sure that they're aligned with each other. They're straight across. Everything fits. You don't have anything broken. You don't have things there. And then if you got a show horse or a horse like Mr. Ed, used to be on TV, that does this a lot, then like Mark said, you get out the floss and you clean up. Working on equine dentistry is not just floating molars. It's balancing the mouth. Looking for signs of TMJ. Maybe looking for signs of what's known as supernumerals.
How regular would you say that their mouth and everything needs to be checked?
Out the gate, probably after they're 5, once a year, unless they show that they need it more often or less.